Welcome to the show, everyone. I am excited about bringing on my first guest who's been on with me. It's been a while. It's been a minute. I have with me Dr. Jeffrey Frost, and he's the owner of AZ Regenerative Medicine. Welcome back to the show. You have been on my radio show, my television show, my YouTube channel, everything. I want you to tell everybody a little bit about yourself and what you do.
Well, my name is Dr. Jeff Frost, as she said, and I've been practicing as a chiropractor and physiotherapist for 33 years. I have multiple certifications, Bachelor of Science majors in anatomy and physiotherapy, chiropractic degree. I was working on my neurology degree, got about halfway through that, had my daughter, so she came priority. But I got to treat a lot of neurological patients as far as ADD and ADHD and manic depressant with that part of my education. I sideline doctor on my pro football team for about 7 years, as a fellowship of Christian athlete doctor for 8 years. I saw a lot of trauma on the field. I've been in nutrition since I was 12. I'm old, about 40 decades now.
Me too.
And so, I do functional medicine as well. I've taken that on, and we do regenerative medicine in my clinic. So that's the name of the clinic, is AZ Regenerative Medicine. So we are we're a full clinic that's integrated with multiple healthcare staff members.
Now, the first thing that you're all about is education. And I want you to kind of explain that because I think it's very important for people to understand how much you like to talk about this, for people to understand what really chiropractic is.
Thank you, Carol. That's why I'm actually on the show today, is because I told you I want to educate the public. There's so many folks that have such misconceptions about their bodies, about symptoms. I think that when you are smarter, when you have more knowledge, you have more power and control over your decision making and your power and future of your own personal health. And as we've seen in the United States recently, taking that information and applying it is going to give us a higher longevity to be able to live longer. So that is my purpose in helping people and educating them so they can make the right decisions for themselves, whether it's in my clinic or going someplace else. I think it's important.
A lot of people are in pain. And, sciatica happens to be at the top here. Probably, I would say 90% of our listeners either have or know someone with a sciatic nerve problem.
It definitely is something that is constantly walking into my clinic asking for help. And one of the things I've seen over the 30 years is the same misconceptions of what sciatica is. And that's why I wanted to come on today. So sciatica really is not just one nerve, it's a bundle of nerves. It's actually from the L1 down to the S1 lower back curve, where they all come together to make a big fat nerve, so to speak, called the sciatica. And as it goes down into your feet, it distributes into different areas. And so a lot of folks will say, I have sciatica, and they always point to their gluteal area, their butt area, if you would, right? And I'm like, well, that's not necessarily true sciatica. So when patients come in, we have to differentiate. Is it a joint problem directly related that's causing it? Is it a muscle problem? Or is it truly sciatica? And then at that point, we can express to people what it is, whether it is truly sciatica, because that's a scary word for a lot of people. They say sciatica, and they're like, am I going to be able to work? Is it going to get worse? Is it surgical? And these are the fears that we want people to get rid of by giving them that education of what they truly have and the right solution in order to keep them out of surgery when we possibly can, because that is our purpose. Our purpose is to get people off of opiates and the crisis we have, get them out of pain, and avoid unnecessary surgery. Now, Dr. Frost is not against medicine. I'm not against surgery. I'm just against unnecessary medicine and unnecessary surgery. And so in our clinic, we use all the natural ways, the physical medicine ways, to be able to restore the biomechanics, to be able to get it back to where it was or as close as possible, to take the pressure off the nerve so your organs can work right again and you can get rid of that sciatica pain, and then teach you how to keep it that way. That is the biggest thing that separates me from a lot of doctors. We teach you how to keep it that way.
You're on 40th and Bell, right off the 51 and the 101, and he does these little phone consultations that people can call and get some information. And you can check him out on his website. It's AZ Regen Medicine, and that's just med, M-E-D, right? So AZRegenmed.com. 33 years that you've been practicing, and you have on Facebook a special that you got on Facebook and on Instagram that's a special, but
Correct.
you wanted to offer our listeners
A little extra.
a little bit extra.
Yeah.
So tell them what it is.
So normally we charge $287 to have somebody come into the clinic and spend 30 minutes directly with me. I won't pass you off to anybody else, but my staff will always be there to support. And that is for a consultation, examination, and we will give you one treatment of decompression and or adjustment if I feel like it's warranted and safe to do at that time.
So as if it's okay with you and you have no choice now, we're live on the air. I'm going to open up the lines to the audience for everyone. For able to call me and get you connected with, to be able to have this $29 value. It's half off of the already special price.
Correct.
And I'm going to leave my lines open here throughout the rest of the show. Maybe it's you or someone that you know. And we all know we're all in pain. We're all a bunch of sciaticas, a bundle of nerves. So our number here is 602-277-5369, and toll free it's 1-866-536-1100. What do you want to say?
And I do have staff members currently right now. My front office manager is waiting also for phone calls. So if you would like to look it up quickly and get the phone number at 602-992-2656, they can directly hook you up with. What we didn't talk about was the free consultations that we do. The free consultation is over the phone for 10 minutes. Make sure this is the right place for you.
Listen up, what it comes with, because it's it's fantastic. You're getting a consultation, which comes along with an examination, and it includes one treatment. That's for $29.
Yes, ma'am.
So our number here is 602-277-5369, or you can also call them direct. They're waiting. The operators are standing by. They're waiting for you to call. The number is 602-992-2656. Check them out. It's azregenmed.com. So let's talk a little bit further here. So you're talking about pressure on the nerve, right? How do you do it? How are you going to find out where that pressure is coming from, number one?
Well, that's where the orthopedic neurological exam comes in. Chiropractors are highly educated with the physical body versus your medical doctors. Again, I'm not against medical doctors. I have friends that are medical doctors. We're just trained differently. But when you have physical pressure being applied to a nerve root, you have to do the correct orthopedic neurological examination to determine what level it's at. And we can do that without sticking you with needles or doing nerve ablations to see if it's going to work. We can do this and pinpoint this. If we need to, we'll refer you out for an MRI to validate.
So what happens after that? You know, what's the next step? Now you find out, yeah, you got some pressure there.
Mm-hmm.
I mean, what do you do?
Well, again, educating the patient, whether it's in the neck, upper back, or lower back, of what the problem is. So I brought some models here that the radio can't see, but I brought...
well, we can see. We're live on Facebook to hide everybody out
So
there.
these are the different levels of degeneration, healthy all the way to really, really bad fusion, if you would. And so I explained to the patients which level they're at, and then tell them how we want to get them go back in reverse, the opposite direction. So how do we do that? Well, this got to be in a really negative, bad situation, such as degenerative disc disease or bulging discs or extruded discs because of chronic problems over time, unless it was an acute injury like bungee cord jumping and the cord breaks or a bad motor vehicle crash. And the same process is the same way we can reverse this and help you, teach you to get that disc to go back in, take pressure off by doing physical medicine, physical therapy, chiropractic, and then you're going to have home stuff you get to do. So we're going to teach you how to do that. So I'm looking for the people who really want to get better and want to put the efforts in.
How many people don't want to get better? As I know, we all do. So you could call them direct at 602-992-2656. You're getting this $29 consultation that comes along with an examination. It includes one treatment. Call 602-992-2656. Hang tight. We'll be back in just a minute. That's already one. Okay, here we go. We're going to keep on going in here because we are live on Facebook. So, okay, now somebody, you've gotten to that point where now they've been educated, you know where it's coming from. What are the next steps?
Really, it's helping them to understand that repetition builds memory, good or bad, and they've had a bad situation go on for a long time where now we have to change that bad memory and recreate a new one in there. So the way the cerebellum is made, the brain, that part of the brain that it functions and operates all mechanical, muscular, skeletal, muscle function, including the heart, the bowels, that has a memory in there. we're born with a good memory most of the time, and then as we have body parts that have been damaged due to motor vehicle crashes or just growing up. So, Carol, the average 13-year-old has over 1,500 spinal traumas just learning how to ride a bike and play sports.
Sure,
right?
I can see that.
We don't necessarily go to the hospital, and then between the age of 13 and 15, we lose our direct blood supply to the spine, to the disc. That disc is normally 90% water. But when we have the scar tissue that's occurred over the first 13 years of 1,500 spinal traumas, it restricts this motion of this vertebrae moving the way it's designed to pump the water nutrients in after we lose the direct blood supply.
Oh, God.
So that is critical.
That's amazing.
So what ends up happening is we restrict that, and this over time starts to dehydrate, starts to degenerate by losing its nutritional ability. Then we get degenerative disc disease. So you go from beef steak to beef jerky.
I like that analogy.
It's the same beef. All we did was take the water out. But you'll notice that if you try to tear beef when it's fully hydrated, you have to have a knife. But beef jerky, same beef, you can tear it easily because it cracks and splits and becomes very weak. And that's where we start getting the bulging of the discs. When the discs start to decrease in height, the hole where the nerve comes out starts to decrease in height, so it doesn't have the same amount of movement and ability to be able to motion, and that's where most of the time we get the pressure, is because the disc is dehydrating, reducing the hole where the nerve comes out. So we have to do what? We have to reverse that, so we have to rehydrate that disc. And I have a system I learned 19 years ago from a gentleman who put 40 to 50 years of his life into it. It's called the Pettibon system. And it's the only, and it's patented, and it's the
It's
only.
your system?
No, it's Dr. Burl Pettibon's. I learned and have been applying it since.
Can we talk about that?
Oh, yeah.
Okay.
Absolutely.
I'm just making
And
sure.
so that's what rehydrates the disc and reverses this process and heals the cracks again.
Well, we're going to have to talk about that. Are you
Sure.
the only one that does that here?
The only one that I know of that does the system fully,
Okay.
completely.
Talk about that. Here we go. So welcome back, everyone. And I have to say, every single time we are on break, I learn much more as we go on here, because we're talking live to everybody on Facebook land out there. And well, we were talking about the different discs, and I had asked you, okay, now you find out where the pressure's coming from, and then what's next after that. And you went into this whole thing. It was amazing. I know we only have a small amount of time, but I think you should tell them a little bit about it.
I'll keep it high level.
Okay.
And I'll keep it easy.
Okay.
Okay, first of all, we're going to give you some educational facts. Remember, we're going to make you smarter. So hopefully, if nothing else, by the time you're done with this show, you'll be smarter than before you started listening to it about your own body. So the average 13-year-old has over 1,500 spinal traumas. We don't necessarily go to the hospital for them, but they do create scar tissue around the joints of the spine. It's learning how to walk and ride bikes and play football and gymnastics, etc. But by the age of 13 to 15, everybody loses their direct blood supply to their disc. Now, why is that important? Well, your discs are made of 90% water when you're born. You want to keep that because that disc height, that determines the height of the hole the nerve comes out of the spine that operates your body and makes your sciatica function the way it's designed, which is without pain. So what ends up happening when we lose our direct blood supply between the age of 13 and 15, we actually we have to rely on the motion of the vertebrae above and below at 100% motion. The restriction comes from the scar tissue that we don't know that we have. Scar tissue has different properties. One of them is it shrinks over time. Ask any woman who's had a C-section. They're worried about that fat old scar and whether their bathing suit's going to cover it up, right? But the doctor always says, no, it'll be a thin line. That's because scar tissue shrinks. Well, it shrinks around the spine as well, which restricts the full motion that the spine needs in order to push the water and nutrients in and the waste out to keep it healthy. So 20, 30, 40, 50 years later, we end up with spinal degeneration, degenerative disc disease. Dehydration of the disc is really what it is.
Wow. And you said you have to keep it hydrated, but you mentioned something that you learned a long time ago. Listen up. This is pretty cool. Listen up.
Oh, so yeah, sorry.
Big time.
Yeah, so you want to talk about the Pettibon
Yeah.
system. So yes, it's a system that Dr. Burl Pettibon created 40 to 50 years ago, and he actually has a chair that we do 7 different exercises on the low back that is patented specifically for rehydrating the disc. Now, for 8 years, I did pre and post X-rays on my patients and validated that those discs do rehydrate. Even the ones that are dehydrated to the point of air, we were able to get water and nutrition in. We're also with the decompression machine, which is part of the system, pull discs back in. I have several studies where I have done that pre and post MRI, a 16 millimeter extruded disc on a 57-year-old Russian man that couldn't speak English. After 28 visits, we did another MRI. It pulled all the way back up inside, and a gentleman over at Banner, one of the head radiologists, validated it was 100% healed. And we had no needles. We didn't do any regenerative medicine. We did nothing but basically go after the physical laws and the neurological laws which we were created, and applied those to reverse the process, and the body can heal itself. Not everybody can get that result, but we get it more often than not, and we keep people out of surgery. I've recommended people to have surgery on some of these things, called Barrow's Neurological Clinic up, and they're like, no, go ahead and give it a try. We think, and I've pulled a 16 millimeter disc all the way back in again, and I recommended the guy to have surgery, and I'm thankful that that neurologist was smarter than I was at that point, and we did what we needed to do to help him.
And I had asked you if you were the only one that does this, and you said you're the only one that does it fully.
Yeah, I don't know of anybody else. I've tried to refer to other doctors who do the Pettibon system, but I learned that they don't do it fully, which means they're usually leaving something out. And so if you can find somebody, folks, that does the Pettibon system fully with decompression, the wobble chair, and do all the proper exercises that are designed to go with this program, and they're close to you, I do recommend, please look them up and find them.
But you have him right here, sitting here. Dr. Frost is sitting here, who does it fully. Now, we've got our lines open here for everyone to get entered in to win. It's a $29. It was $49 on Facebook and Instagram, but for everyone that's listening to my show, you're getting it for $29. It's a consultation. It comes along with an examination, as well as it includes a treatment. So we've got our lines open here, and we'll let everyone call throughout the rest of the show, whether it's for you or someone that you know. Our number here is 602-277-5369. They also have people waiting there for you to call them at, which is 602-992-2656. They would love to do a free consultation for you, at least a phone consultation, to find out how they can help, whether it's you or someone that you know. You can check them out. It's azregenmed.com. So real quickly before we get going here, I want to know, is all of this disc disease and everything, is it reversible?
Yes.
Okay, that's a good one-word answer. Okay, how do we do that? By what we're talking about
with
here.
the system.
And repetitive, but learning. It's learning it, relearning everything. Repetition.
Yeah, so the system, when patients come in, we actually have it all written down, and we show them the photographs. We show them the photographs of the equipment they're going to be having at home. It's small equipment. You can put it underneath your bed. But my staff is going to train you on how to do exercises specifically designed for fixing the muscles so they can go back to their normal function, to help to reverse this while they have a wobble chair, which is what I was talking about earlier, that chair that actually is patented. They're going to have one of those at home. They'll do it twice a day. This will exchange the wastewater nutrients in the disc 100% within 24 hours. The normal spine will only do it one time every 270 to 280 days without the wobble chair. And this is how we get the accelerated rate in 2 months. Generally, it's almost 2 months maximum where we can make this reverse happen and teach them how to keep it.
It's worth it to me. You know why? Because I don't want to have surgery, definitely. But we got to talk about regenerative medicine. Can it help?
It can help. I don't always recommend it, number one, with the spinal stuff, but when we do use it, we seem to see what we would call accelerated rates and more complete rehabilitation and regeneration of the areas on extreme situations.
I want to ask you, because we've been talking about spine.
Yes.
Okay. Necks, can we do necks?
Yes.
How about knees?
Yes.
Knees, elbows, carpal tunnel.
I don't use that so much for carpal tunnel. There's another process that I use that's called the double crush syndrome. We'll have to do that on another show. but that's where your nerves in your neck are not happy and they cause your carpal tunnel to not function right. You actually have to go after and treat both at the same time, but it's not one that I would necessarily, or have seen regenerative medicine be 100% effective. I like to go after the low-hanging fruit and have people not spend any more money than they have to get the same results.
Well, he's got a special that he runs on Facebook and in Instagram, which it's $49, but here all our listeners are getting it half of half. It's already half. It's already half, and we're getting it a special for $29. It's a consultation that comes along with an examination, and it includes one treatment for $29. He's located at 40th and Bell. That's right off the 51 and the 101. And he would love for you to call them, whether it's you or someone that you know that's dealing with pain. You don't have to be. It is reversible. These things, as pains, however long you've had it, it can change.
Yes, one of the things I wanted to share, Carol, is we do have a lot of patients come in that are post-surgical where they've had rods and screws put in their lower back and they want to know if I can help. I let them know that no, those areas I actually cannot help, that they've already fused. But the ones above and below now are having to work extra hard to make up for the loss of function there. That's the body's natural way of function. It wants to continue to adapt. So I tell people, let's at least try to get the pain reduced, if not gone, and teach you how to keep the vertebrae above and below that are still functioning to be able to stabilize, hoping to keep you out of another surgery. I've been told that the average person that has one spinal surgery will have an average of 3 by the time they pass away. And I'm sure it does matter at what age you actually get that first surgery.
Sure. Well, I'll tell you something, folks. I know that a lot of us are in a tremendous amount of pain, and a lot of it happened from doing sports and all of that. And now you're older, and it's hard to walk, it's hard to move, and you know what? You don't have to be in pain. You've been doing this for 33 years, so
Yes,
you
ma'am.
really know your stuff, and you really are out there. You wanted to come on to educate. What are your final words?
Folks, you don't have to live in pain. It is absolutely not necessary if we have the right solutions for you. And I tell people, if you think you're surgical, if you can't walk, like I have people coming in with walkers, and they're getting rid of them. So with that being said, I'm going to tell you, take the opportunity to learn more about what your body is like, the condition it's in, and how to get it better, and we're happy to be there for you.
So we've got this special that we're running. You can either call me throughout the rest of the show, and I'll get you connected with him. And our number here is 602-277-5369. This is a $29 value. It is a consultation. It comes along with an examination. It also includes a treatment, all for $29. Where are you going to find that? Nowhere, except on Networking Arizona. So call him direct. They would love it. Or you can also call me. His phone number is 602-992-2656. Check them out. They want to do a free consultation. They want to help you guys out there feel better. Again, his website is azregenmed.com, or call him at 602-992-2656.